Hello, this is Paul Middleton coming to you from Unconventional Conventions and Take Heart Australia, showing you that CPR training, high quality CPR training, can be done even in the middle of the Antarctic at the top of a very snowy hill. Here we have a man who seems to have been buried in an avalanche. He's collapsed, he's unresponsive. We've got rescuers coming down to him and they're going to do the doctor's ABCD approach.
Mate, are you all right?
So the rescuers check him for danger and check him for response, and there's no response. So she immediately knows she has to call for help very loudly.
Really, help me.
That's what she's doing. We've got other rescuers on the way, and her next action is to check for breathing. So she tilts the head back and the chin lift to open the airway, puts her head, as you can see, down next to the patient with her ear over his mouth, listening for breath sounds and looking down the chest and abdomen, looking for abdominal or chest movement, and she can see no breathing whatsoever. So by definition, this patient is unresponsive with no normal breathing, so they are in cardiac arrest. And the very next thing she's done, as you can see, is to start immediate high quality CPR.
Someone help me, this man.
So what you can see is the rescuer is calling for help, and there are other rescuers coming now to give some assistance. What she's doing at this point is doing chest compressions a third of the depth of the chest at 120 per minute, releasing the chest fully each time to ensure the blood comes back into the thorax again, and not having any gaps whatsoever in CPR. One of our rescuers is just holding the airway open, and this is compression only CPR, high quality CPR. So we're coming up to 2 minutes, and what's going to happen now is that our rescuers are going to change over without any gap in CPR, and we're going to do this after 5, 4, 3, 2, 1. And here you can see, again, immediate CPR with no gaps. If you look at the posture here, you can see that the rescuer has got the fingers interlocked over the centre of the chest, his elbows straight and arms locked, and the shoulders over the hands and bending forward from the hips. And here we are coming up to another 2 minutes, and our third rescuer is going to take over CPR after 5, 4, 3, 2, 1. Once again, immediate CPR without any gaps. So in summary, what we've seen today is training in CPR at the top of a very large hill in the middle of the Antarctic, just to show that you can do it anywhere. To reiterate, what we're doing is compression only CPR. We are doing chest compressions at a third of the depth of the chest, 120 a minute with full release and no gaps in between compressions. I'm Paul Middleton coming to you from Unconventional Conventions and Take Heart Australia.